Hello and welcome. Today, we're diving into something that so many stroke survivors go through, but very few people really talk about. We're talking about those sudden, uncontrollable, and honestly, sometimes really inappropriate emotional outbursts. If that sounds at all familiar for you or maybe for someone you love, you are definitely in the right place. Let's get into what is really going on here.
Have you ever found yourself in that situation? It's so strange, right? One moment you feel one way on the inside, but your face, your voice, they're doing something completely different. You could be watching a simple TV commercial and just burst into tears, or hear some serious news and have to fight back a laugh. It can feel like you're not in the driver's seat of your own emotions.
And that feeling of not being in control can be incredibly isolating. It's confusing for you, and you can bet it's just as confusing for the people who care about you. They might not get what's happening, and that can put a real strain on your relationships, right when you need that support the most.
So, what is behind this confusing emotional roller coaster? Let's finally put a name to this experience and really understand why it happens.
So, take a look at this number. A pretty staggering 53% of stroke survivors, that's more than half, report having these exact symptoms. So, if there's one thing you take away today, let it be this. If this is happening to you or to someone you love, you are so far from alone. This is actually a common part of stroke recovery. It's not discussed nearly enough.
But here's where it gets wild. Even though over half of survivors are going through this, less than 20% have ever even heard of the condition that's causing it. That is a huge awareness gap, and it's why so many people end up suffering in silence, feeling frustrated and confused, with no idea that there's a real medical reason for all of it. Well, it's time to bridge that gap. This condition has a name, and just understanding it is the first, most powerful step toward managing it.
Okay, so the medical term is Pseudobulbar Affect. Let's just call it PBA for short. And the most important part of this whole definition is that phrase, disconnected from your actual feelings. This isn't about you being too emotional. It's about the outward expression of your emotions not matching how you actually feel inside.
And this right here is probably the most critical thing to grasp. PBA is not a psychological problem. Think of it like a short circuit. A stroke can damage the wiring in the brain that controls how we express emotions. So the signals get crossed, and that can trigger these involuntary episodes of laughing or crying. It's a hardware problem, not a software problem.
And this brings us to a really important distinction. Because PBA so often involves uncontrollable crying, it gets mistaken for depression all the time. And that can lead to the totally wrong kind of treatment and just a whole lot of unnecessary frustration.
This chart really lays it out perfectly. See, with PBA, the episodes are short, they're spontaneous, they kind of come and go out of nowhere. Depression, on the other hand, is a persistent, ongoing feeling of sadness that lasts for weeks or even months. With PBA, the outbursts are a neurological reflex. With depression, the crying is directly tied to that sustained low mood. Two very different things.
And we just want to take a quick moment to mention that this explainer is brought to you by DailyCaring.com. They're a fantastic website that supports caregivers all around the world with practical advice and resources just like this one.
Okay, so now that we know what PBA is and what it isn't, let's get practical. What can you actually do to manage these episodes when they happen? Let's build a little toolkit.
All right, if you're a caregiver or a family member, your role here is just vital. First, try to keep a simple log of when these outbursts happen. That kind of information is absolute gold for a doctor trying to make a diagnosis. Second, please constantly reassure your loved one that this is a physical side effect of the stroke. It is not a sign of weakness. And finally, just let them know you're there for them, that you get it, and that a lot of people go through this. Your understanding can make a world of difference.
Now, if you are the one experiencing PBA, there are also things you can do to feel more in control. First, just being open with people can really help prevent confusion. When you feel an episode starting, try to distract your brain. Count things in the room, do a simple math problem in your head, anything. Focus on taking slow, deep breaths. Consciously try to relax your shoulders, your jaw, your forehead. And sometimes even a simple physical change like standing up or just shifting in your chair can be enough to interrupt that neurological signal.
So with this new understanding and a whole toolkit of coping strategies, what is the single most important action you can take right now?
It all comes down to this. Talk to a doctor or a neurologist. Getting a formal, accurate diagnosis is everything. It validates what you're going through, it rules out other things like depression, and it opens up the conversation about treatment.
There are actually medications that can help reduce how often these PBA episodes happen and how severe they are, but a doctor is the only one who can really guide you through that.
You know, in the end, it really all comes back to this idea. Knowledge is power. Simply understanding that there's a real neurological reason for these outbursts can lift this huge weight of guilt and shame and confusion. And that can allow you and your loved ones to finally reconnect.
So we'll just leave you with this question to think about. If this whole experience has felt like a total loss of control, could something as simple as one conversation with a doctor be the very first step toward getting it back? Thanks for joining us.